Assistant Professor Venerable Thero, Dean Faculty of Language Studies, Venerable Dr. Thero, Coordinator Research Session of the Academic Staff, Pali University of Sri Lanka, and other lecturers, Professor Samanthi, Dean Faculty of Language Studies, and other lecturers. My topic is a comparative study on the concept of mental disorder as revealed in Buddhist psychology and abnormal psychology. As you all aware, Buddhist psychology has become one of the most popular school of psychology in the present modern world. By combining we know that Buddhism or the Buddhist doctrine or Buddhist philosophy is very much psychological. By combining the psychological teachings of Buddhist philosophy or the Buddhist doctrine and the psychological teachings of Western psychology, this unique school of psychology has been developed. The first person who used the word Buddhist psychology was Mrs. Rhys Davids in her books. No? So here I would like to take an attempt to examine how the concept of mental disorder has been analyzed, interpreted in Buddhist psychology, and also how these concepts have relationships, and also how the similarities and dissimilarities prevailing in abnormal psychology. Abnormal psychology is considered as one of the main branches of Western psychology. So this is basically a qualitative study. Literature review is done on comparative basis. Basically here the teachings of mental disorder in Buddhist psychology are analyzed with reference to the teachings of the mental disorder in Diagnostic Statistical Manual of Mental Disorder. I will explain what is meant by DSM later, and in the same way abnormal psychology. So the research question of my study is the Buddhist concept of mental disorder similar to the concept of mental disorder in abnormal psychology? In understanding the psychological abnormality, basically related to mind in Western psychology, there are two main branches of psychology called clinical psychology, abnormal psychology. So these two branches of Western psychology focus on understanding the human abnormality. Clinical psychology is much more interested in treating the people with mental health problems, whereas abnormal psychology is interested in understanding the causes, the nature, and the treatment. It also talks about the treatments of the mental disorders. However, when compared with abnormal psychology, clinical psychology is much more developed. You find there are various types of clinical psychologists in the world, and also in Sri Lanka also there are a large number of clinical psychologists. So clinical psychology is much more developed research area compared to abnormal psychology. However, in Western psychology, in understanding psychological abnormality or the mental disorders, both clinical psychology and abnormal psychology are important, and I will do the research related to abnormal psychology. So as mentioned earlier, abnormal psychology is basically concerned with understanding the nature, how a particular mental disorder exists, and the causes of mental disorder, and also it talks about the treatment of mental disorders. But compared with clinical psychology, clinical psychology talks much about the treatment procedures of mental disorders. So, in the mental health field, common terms we can identify similar words to mental disorder are abnormal behaviors, deviant behaviors, behavioral dysfunctions, mental illnesses, mental disorders. These words have a unique meaning. However, commonly in the mental health field, we use these words to denote the word mental disorder. So, what do we mean by a mental disorder? This is really important. This is called Diagnosis and Statistical Manual of Mental Disorder. Mental disorders. Shortly we call it DSM-5. So this is basically a manual. As we all know, a manual includes almost all the information that should be followed by a professional. So this manual also includes almost all the details regarding the mental disorders. The people face various types of mental disorders. So almost all the mental disorders are included in this manual. So this is a publication of American Psychiatric Association. There are two main manuals in the world today used by mental health professionals. One is this DSM-5. This is basically used by European and Western psychiatrists, psychologists and clinical psychologists. Next one is the ICD-10, International Classification of Diseases, which is a publication of World Health Organization. So ICD-10 is mostly used in Sri Lanka and in Asian countries. However, DSM-5 is also used. I chose DSM-5 because it is much more descriptive and there are a large information is available in DSM-5. So we will look into DSM-5. What does it mean by a mental disorder according to DSM-5? So it says a mental disorder is a syndrome. What is meant by a syndrome is a collection of symptoms. Collection of symptoms means a syndrome. So a mental disorder is a syndrome characterized by clinical significant disturbance. A person to be identified with a mental disorder, that mental disorder should be clinically disturbed. The person who is having that mental disorder. So and it also says clinically significant disturbance in individual's cognition. A mental disorder can affect your thinking ability. You know that there are various types of cognitive distortions with people with mental illnesses. They think in an extreme way, and in the same way there are problems with emotional regulation, and also the behavior of people with mental disorders is also maladjusted and dysfunctional. And a mental disorder obviously can affect negatively the psychological, biological and the developmental processes. And also what is mostly important is most of the people with mental disorders experience psychological distress. Unless you have a disorder like called bipolar disorder. So bipolar disorder is a psychotic disorder where you experience mood changes. So there is mania and depression. So when it comes to mania, the person is really happy and he's having euphoria. And when he or she is having that kind of thing, he or she doesn't experience psychological distress, but it is still a mental disorder. So significant distress, and also a mental disorder can obviously negatively affect a person's social, occupational and other important activities of the life. So according to abnormal psychology and also according to clinical psychology, and commonly when it comes to Western psychology, when the clinical clinicians or the mental health professionals suspect whether a person is having a mental disorder, they pay attention to the behavior. If one's behavior is abnormal, we say that person is having a mental health problem or a mental disorder. So how do we identify? We consider the behavior because behavior is the only observable indicator, because we can observe the behavior, we can't observe the thinking pattern. So how do we identify a normal behavior from abnormal behavior? So according to DSM-5, it points out 4 major indicators of an abnormal behavior. So if these are included in a particular behavior, we say that person is having an abnormal behavior, and we say that person is having a mental disorder. The first one is deviance. So if a particular person's behavior is deviant from the social and cultural norms in which the person lives, we say that behavior is a deviant behavior, and we say that he is having a mental health problem. But however, most importantly, almost all the deviant behaviors are not considered abnormal. This is really culture sensitive fact. What is considered in normal in one culture can be abnormal in another culture. For example, homosexuality is considered as an abnormal behavior in most of the Asian countries, whereas in some European and Western countries it is not considered as an abnormal behavior. For example, when it comes to DSM-5, DSM-3, homosexuality was considered as a mental disorder, but now according to mental health professionals, homosexuality is not considered as a mental disorder. So, and the next indicator when it comes to when understanding the abnormal behavior is the distress. People with psychological problems will obviously most of the time will experience distress. It is here basically psychological distress. The people with depression and even sometimes the people with anxiety disorders will experience this distress or the sadness. So what is meant by dysfunction is if a particular behavior related to mental health problem or the mental disorder affect a person's day-to-day functioning, we say that behavior is dysfunctional. For example, if a person with, when there is a person with depression, so that person will not engage his or her daily activities. He or she will sleep on the bed. So that particular behavior, the depression, has affected his or her daily activities. So, and we call that behavior a dysfunctional behavior. And the next one in understanding psychological abnormality is danger. A person's behavior can be, if a person's behavior is dangerous to himself or herself, we say that behavior is an abnormal behavior. You know that there are various types of mental disorders like schizophrenia, sometimes bipolar disorder. So these people experience hallucinations and also various types of delusions. They perceive things which are not in the environment. So sometimes they hear voices and sometimes these voices command them. So they may harm themselves, they may commit suicide, and also sometimes they may harm others also if these voices command them to do so. These voices and perceptions are really unbearable. So people with mental disorders sometimes commit suicide and also they may harm others. So if these four things are the indicators of an abnormal behavior. Apart from that, if a particular person make a person very much disabled, and also if the behavior is maladaptive and also statistically deviant, and also if a particular person's behavior make others social discomfort, we say that those behaviors are abnormal behaviors. And also if a particular person's thinking pattern is irrational, strange, and also it makes others discomfort and inefficient, we say those behaviors are also abnormal, and we suspect that person is having a mental disorder according to Western psychology. However, there are a large number of facts should be considered when we come to a conclusion whether a person is having a mental disorder or not. There are biological causes, psychological causes, social cultural causes are related to in understanding the psychological abnormality of human beings according to Western psychology or abnormal psychology, and also with related to clinical psychology. So now I would like to direct your attention towards how Buddhist psychology has analyzed the concept of mental disorder. One significant instance can be identified in the Pali, the Vinaya Pitaka. The Buddha says that if there is a person who is mentally unstable, who is mentally not fit to conduct the uposatha, the other monks can release him by giving them their consent. So according to this Pali, we can identify that there are mentally unstable people, however with defilements. And also according to Buddhist psychology, we can identify two categories. There are people who are mentally stable, however with defilements. There are people who are mentally unstable, but also with defilements. One of the most important things is that when it comes to Buddhist psychology attributes mental illness to just one cause, mind. Whereas abnormal psychology tries to understand from a behavioral point of view. However, Buddhist psychology also talks about the behavior as mentioned earlier. However, the emphasis is put on the mind. So the concept of mental disorder has been analyzed in Buddhist psychology related to the defilements. So we find the words like kilesa, upakilesa, anugata, cheto, kila, asava, oga, yoga, nivarana, etc. which related to the concept of mental disorder in Buddhist psychology or the Buddhist doctrine. In the Roga Sutta is very important in understanding the mental abnormality. In the Roga Sutta, the Buddha says there are two types of mental illnesses. Two types of illnesses called Kayiko Rogo and Chetasiko Rogo, physical illness and mental illness. This here Buddha points out, he says that a person can live 100 years without a physical illness, but a person cannot live even a moment without experiencing the full psychological freedom unless he or she is an arahant. So according to Buddhism, who is experiencing the maximum level of psychological freedom or who is experiencing the maximum level of healthy psychology is an arahant. The Sotapanna, Sakadagamis and Anagamis will experience the psychological freedom depending on their level of defilements. However, Buddhism does not exclude the existence of physiological conditions among mental illnesses. As we all know, in the Nalakalapa Sutta also, Buddha points out there is a close relationship between mind and body. So as I mentioned earlier, mind is the most important when it comes to understanding the psychological abnormality in Buddhist psychology. These akusala dhamma or the unwholesome states or the unwholesome thoughts are really important. So Abhidhammatta Sangha points out various types of unwholesome states which we can consider. These things are related to mental illnesses or mental disorders when we look at this from a Buddhist point of view. So these are called unwholesome because they are mentally unhealthy, and also they are called unwholesome because they are morally blameworthy. So this is really very much related to the concept of Western psychology in understanding the abnormal behavior. So the deviant behaviors are considered as abnormal when it comes to abnormal psychology, Western psychology. And also these are called unwholesome because they are unskillful and also the productive of painful results. These unwholesome thoughts will direct you to suffering. So in understanding psychological abnormality in Western psychology, all it shows, as I pointed out earlier, it says the psychological distress is one of the most important indicator of understanding the abnormal behavior. So Dhammasangini points out like that. So mental illness, mental disorder is determined by the manifestation of defilements according to according to Buddhist psychology. Apart from Buddhist Pali canon, we can find various types of instances which are related to the concept of abnormality. When you examine the Pali literature, Majjhima Nikaya Atthakatha, Patisambhidhamma Atthakatha, Sammoha Vinodini Atthakatha, and also the Visuddhi Marga includes this phrase Ummattako Viyahi Putujjano. So the ordinary people have some kind of madness according to Pali literature, Buddhist literature. And also in the Samyutta Nikaya it is clearly stated that Antojata Bahijata, this phrase points out, it directs us to think that the ordinary people are confused with various types of problems. And also this can be really related to the Western psychology also. Even when it comes to philosophy, it is also important. Aristotle also says there is no great genius without a mixture of madness. And also father of psychoanalysis, Sigmund Freud, also says that we all have some kind of neurosis. It means that we all have some kind of madness within us. So I have taken some most important suttas which can be considered as mental disorders. So Salleka Sutta includes 44 mental health conditions. These are really defilements. We should understand that. And also the Purusha Sutta points out Lobha Dosa Moha as one of the significant defilements. So it basically says Ahitaya, Dukkaya, Apasuyaraya. So it clearly points out this is very much related to the concept of mental disorder also. So in Western psychology also and abnormal psychology also it says a person with mental disorder will experience suffering. So it is also mentioned here, Dukkaya, Ahitaya. So it is not supportive for the person. And also a mental disorder will make a person inconvenient and will make some kind of discomfort, apasuvihara. So there is a relationship. So in the Kuddaka Nikaya of the Mula Sutta of the Kuddaka Nikaya, it says Lobho, Dosocha, Mohocha, etc. like that. It also points out the importance of psychological abnormality in understanding understanding it from a Buddhist perspective. And Panchime Vikke Avarna, Nivarna, Chetasa, Upakkanesa, Kannaya, Vibhalikarana. So it is really important according to the Samyukta Nikaya. From abnormal psychological perspective, from clinical psychological perspective, also a persons with mental disorders will experience some kind of irrationality and also some kind of cognitive distortions. So Pannaya Vibhalikarana can be related to that. It will limit your wisdom. And also the Samyukta Nikaya also said Ajnana Karana, Pannana Nirodhaka, Andhakarana. So it is also related to that. The Veranjaka Sutta of the Majjhima Nikaya points out how a person can show his or her psychological abnormality according to it. Kayana Dhammachari Visamachari, Vachaya Dhammachari Visamachari. So it says that a person can exhibit psychological abnormality through his or her words and also through the body and also through the thinking pattern. So in understanding there are a large number of various discourses related to psychological abnormality we can find in the Tipitaka. I have selected some suttas. So Tanha Vagga of the Dhammapada is really important when we understand the psychological abnormality of the human mind. And Chuladhamma Samadhana Sutta, Mahanudana Sutta, Dhammacakkappavattana Sutta, and also very important the Vattupam Sutta and the Anumana Sutta. There are a large number of other discourses also which classify various types of defilements. So these defilements we understand from if we understand these things from a psychological point of view, we can say these things are some kind of mental disorders. So I have graphed here the psychological disorders according to Buddhism: Akusala Moola, Oga, Panchanivarana, Anusaya, Upakkhilesa, Dasasanyojana. These things are, according to Buddhist psychology, can be considered as mental illnesses or mental disorders. And also, when we refer the Buddhist literature, Venerable Chandramala Thero's Keles 1500, that book is really important. And also, in understanding psychological abnormality, Panchaka Dharma are also important. And also the Vibhanga Pali, Buddhaka Vattubhanga is also important in understanding the psychological abnormality. It discusses about, those books discuss about the various types of defilements. So, here, as we all know, there are three stages of defilements in Buddhist psychology or the Buddhist doctrine called Anusaya, Pariyuttana, Vitikkama. I am not going to explain these stages. What I want to make the point here is that this is really similar to the Western concept of understanding abnormality. So, in the Western psychology, there is a mental disorder called OCD, obsessive compulsive disorder. So, what is meant by obsession is, obsessions are persistent thoughts, ideas, impulses, images that seem to invade a person's consciousness. So, it is just a thought that the person who is experiencing this OCD, he or she cannot control this thought. He or she should do something to control this obsession. That behavior is compulsion. Behavior is called compulsion. Compulsion is, what is meant by compulsion is, compulsions are repetitive. So a person should do it again and again. So repetitive and rigid behaviors or mental acts. It can be a mental act also. People feel they must perform in order to prevent or reduce anxiety. So when it comes to Anusaya state, according to Buddhist, from a Buddhist psychological point of view, there are the defilements are dormant and they are not active. So when it comes to Pariyuttana stage, the defilements are arising. It can be similar. It can be related to the obsessions. So the obsessions are persistent. He or she wants to do that. And when it comes to Vidikkama stage, from a Buddhist psychological point of view, the person will engage in the activity. So it can be related to the compulsion where the person engage in the action. So if I conclude, when understanding the similarities and dissimilarities between abnormality between abnormal psychology and Buddhist psychology in understanding the concept of abnormality, abnormal psychology or the Western psychology focuses basically on the behavior. However, mind also focus. However, when it comes to DSM-5, the emphasis is focused on behavior because the behavior is the only observable thing. However, when it comes to Buddhist psychology, emphasis is put on the mind. That is really important. And when it comes to abnormal psychology, the concept of abnormality has been analyzed to daily life and this life. So the clinic, all the mental health professionals will only treat the person to sort out his or her daily life experiences. However, when it comes to Buddhist psychology also direct the person to solve the daily life problems, and also it talks about the samsaric life. Buddhist psychology looks at the being from a very broad perspective, and it talks about the samsaric life. And also, when it comes to abnormal psychology, no eradication of defilements. That is very important. So, and these lobha, dosa, moha and other defilements are not considered as important when it comes to abnormal psychology. However, when it comes to Buddhist psychology, eradication of defilements are really important to experience the maximum level of psychological freedom. And also, when it comes to abnormal psychology, it does not relate to religious or spiritual development. Though a person who is, let's suppose that a person has been diagnosed with a mental disorder and he later with the treatment he is okay, but it is not some kind of spiritual development. But when it comes to Buddhist psychology, it is related to some kind of religious and also to spiritual development. Just thank you very much.